Hello guys, welcome to another session. So far we have covered about the introduction to the head and neck region, right? And we have learned about the regional anatomy, the need to study the regional anatomy and all. Today we are going to learn the basic features of skull, right? The osteology of head and neck. By that means we learn about the skeleton of the head and neck consists of skull, cervical vertebrae, and hyoid bone. So this is skull, and all these are cervical vertebrae, and this one is here is hyoid bone, right? So all of this is skull, right? So and these are the cervical vertebrae. C1, that is atlas axis, C3, C4, C5, C6, C7. So there are 7 cervical vertebrae, and after that is T1, okay, thorax or thoracic vertebrae. And here lies the hyoid bone immediately below the neck, right, through which attaches the thyroid membrane and ultimately the larynx and all. Okay, so the osteology of the head and neck includes skull, cervical vertebrae, and hyoid bone. So the bony skeleton of the head and neck is termed skull. It consists of 22 bones, excluding ear ossicles because they don't form any skeleton, except the mandible, the lower jaw. All bones of skull joined together by sutures are immobile and form the cranium. So all the joints of the skull or cranium are immobile, okay, except mandible or lower jaw, which forms a temporomandibular joint. Okay. However, two terms skull and cranium are generally synonymous. Skull is divided into two parts. The upper dome-shaped part, which covers the cranial cavity containing brain, is called as cranial vault or calvaria or brain box. So the bones that protects our brain is called as cranial vault or calvarium, right? So that is called as cranial skeleton or cranium. A lower anterior part is called as facial skeleton, right? So the bony part which forms the face is facial skeleton. And also it is known as the cranium or calvaria is known as neurocranium because it contains brain. And the facial skeleton is called as viscerocranium or splanchno-cranium. Splanchno-cranium. Viscero or splanchn means organs. Right. So it's made up of 22 bones. Coming to the cranium, cranial skeleton consisting of 8 bones, out of which 2 are paired bones, that means 4, and 4 unpaired bones, 4. So total 8. Right? Paired bones are parietal and temporal. Unpaired bones are frontal, occipital, sphenoid, and ethmoid. Show you. So this is cranium, right? This is frontal bone, which is unpaired bone, occipital bone, which is unpaired bone, and this is parietal bone, which is paired one, and this is temporal bone, which are paired one. And if we remove this, right, so the wing-like, like butterfly-like bone is called as sphenoid. That is also unpaired one, and here that is called as ethmoid bone, right? We'll see every detail of every bone later. So those are the cranial skeleton, right? Cranium. And coming to the facial skeleton, splanchnicranium, maxillae, zygomatic, nasal bone, lacrimal bone, palatine bone, inferior nasal concha are paired ones. Unpaired bones are mandible and vomer. We'll see that. I removed one part of the face, right? So that you can appreciate it clearly, right? So the thing here is that is the vomer bone, right? It forms within the nose, right? So that is vomer bone and the mandible. These two. So these two are unpaired bones within the splanchnicranium. So, and this one is maxilla, right? Zygomatic bone, nasal bone, lacrimal bone, and here it is inferior nasal concha, right? Those are unpaired bones of the face. Again, we'll deal with each and every bone in the later sessions, right? Coming to the another important thing, the anatomical positions of the skull. So it is the position of the skull in which orbital cavities are directed forwards. The anatomical position is orbital cavities has to be directed forwards and lower margin of the orbits, that is infraorbital margin, and upper margins of the external acoustic meatus lies in the same horizontal plane, and that plane is called as Frankfurt's line. Okay, and there is also another line which is called as Reed's baseline. The horizontal line is formed by joining of the infraorbital margin and the center of the external auditory meatus. So, if the line joins the center of the external acoustic meatus, it is called as Reed's baseline, whereas the upper margin of the external auditory meatus forms Frankfurt's line. You see, this is the lower margin of the orbit, right? And this is external acoustic meatus. If we join the lower margin with upper margin of the external acoustic meatus, it is called as Frankfurt's line, right? Upper margin of the external auditory meatus. So that is anatomical position. Orbits facing forwards, right? And lower margin of the orbit are infraorbital margin, right? A line forming infraorbital margin and the upper margin of the external acoustic meatus is called as Frankfurt's line, whereas the line joining infraorbital margin and middle of the external acoustic meatus is called as Reed's baseline, right? Reed's baseline. You have to learn this. This is an important thing. Okay. Now let's study skull. Skull can be studied from outside or from inside. So the exterior or interior of the skull, right? You study the skull, interior of the skull by removing calvarium or skull cap. Coming to the exterior of the skull. So exterior of the skull can be studied from all the views because we cannot view the skull entirely, right? That is not possible because the skull is has many aspects, right? So if we see that superior aspect, this is our view. Okay, it is called as NORMA verticalis. So if we see the skull from posterior aspect, it is called as NORMA occipitalis. From anterior, it is called as frontalis. From lateral it is called as lateralis, and from inferior aspect it is called as basalis. So depending on your view, you see, so this is we are only appreciating the frontal view, right? In this view you cannot appreciate posterior view, right? So we cannot appreciate all views in a single view in the skull. Because of that, we study each view, right? This is frontalis, norma frontalis. This is norma verticalis, right? This is norma occipitalis, because we can appreciate the occipital bone, all the posterior aspect of the skull. This is norma basalis. So this is base of the skull, and this is the lateral aspect of the skull. So this is norma lateralis, right? So having that, we'll learn about norma verticalis, all the features of the superior aspect of the skull. When the skull is viewed from above, right, it appears oval and being wider posteriorly than anteriorly. We'll see that. So we are, see, this is norma verticalis, right? So we are looking the skull from above, right? From above. So what are the different features? We can see the frontal bone, we can see the parietal bones, and we can see the occipital bone, right? And we can also appreciate different sutures, right? The joints joining the different bones. So those are the different features. So it has frontal bone, squamous part of frontal bone, the paired parietal bones, and squamous part of occipital bone posteriorly. See, frontal bone, parietal bones, 1, 2, and occipital bone. So these are the sutures. So this suture, and these sutures. Learn them. So the coronal suture between frontal and two parietal bones. It crosses the cranial wall from side to side, right? So that suture is called as coronal suture. Corona means crown. Okay. So the crown means the plane of the crown. Coronal suture means the same plane as the crown's plane. Sagittal suture between two parietal bones, and lambdoid suture between occipital and two parietal bones, because it represents the word lambda, right? I'll show you. So this is coronal suture. Okay, so the same plane as crown, because the crown will be like this, right? So the same plane as crown. So this is coronal suture, and this one is sagittal suture, because it is in the sagittal plane, and this is sagittal suture, and this one here is lambdoid suture. Okay, so it's like lambda. Okay, this part is sagittal suture, and this one is lambdoid suture. So the point where sagittal suture and lambdoid suture meet is called as lambda, right? So that is features, and there are another features which are bregma. Bregma is a point at which coronal and sagittal sutures meet, right? And parietal eminence or parietal tuber. It is an area of maximum convexity of the parietal bone. Vertex. Vertex is the highest point of the skull. Highest point of the skull is vertex. In Telugu we call it as మాడు. మాడు నొప్పి వస్తుంది, మాడు మండిపోతుంది అని అంటారు. అంటే ఏంటంటే vertex, highest point of the skull. It lies on the sagittal suture near its middle and is situated a few centimeters behind bregma. Parietal foramen. It is a small foramen in parietal bone near sagittal suture in front of lambda. Obelion. Point and sagittal suture between the two parietal foramina. Right? So this is this is coronal suture and this is sagittal suture. So the point between this is called as bregma, right? And immediately behind bregma, here is the highest point of skull, called as vertex. And these are parietal foramen, and the point between these two parietal foramen is called as ovalion, right? And the point, adjoining point between sagittal suture and lambdoid suture are called as lambda, right? So if we draw a line, so this is vertex, okay, because that is the highest point of the skull. And also there is here there will be highest convexity of parietal bone is called as parietal eminence or tuber, right? So that is norma verticalis, okay, the view from superior aspect, which has a frontal bone, right, paired parietal bones, occipital bone, and coronal suture, sagittal suture, lambdoid suture, bregma, obelion, lambda, parietal eminence, parietal foramen, vertex, right? So with that, that is the different osteological features of norma verticalis. Okay, so let me know if you have any doubts.